Welcome to today's episode of the Buzby Dog Podcast, where we're going to talk about urinary incontinence in senior dogs. All right, so please don't, turn me off right now because it doesn't seem very exciting. If you have a senior dog, I think this is a really relevant and important topic. I hold a very special place in my heart for senior dogs, and I really don't know if it's because by virtue of the type of practice I have now that they are the majority of my patients, or if it's because I've always loved rooting for the underdog, or if it's because it's just a beautiful thing to see the bond that's formed between a dog and a person when they've shared huge chunks of life together, and that tends to be true the older the dog is. I've had clients come to me with a dog that has seen them through the loss of a spouse, through a nasty divorce, through the loss of a child, through some act of violence, crime that was committed against them. And I've developed over the years just more and more of an appreciation, almost a reverence for these dogs, these old sweet dogs who have loved their person so faithfully. And it brings significance, I think, a more special place for me as a veterinarian to be able to treat senior dogs. I'm blessed to do that and try to help people maintain that relationship with their dogs for as long as possible by helping the dogs live as long as possible with a quality of life, a really excellent quality of life. And so when we talk about an issue like incontinence, which I'm about to define, this is one of those places where it can affect quality of life for the dog, and certainly be a real heartbreak for an owner who's dealing with that. Urinary incontinence is kind of a big word, 7 syllables. But simply put, it's the involuntary leaking or dribbling of urine. And involuntary is the key operative word here, because sometimes the senior dog might have an accident in the house, which may seem like the same thing, but in fact, they're two different things, an accident versus incontinence. With incontinence, the dog, like I said, involuntarily doesn't have knowledge of this happening. An accident, typically the dog knows when it happens, even if it wasn't supposed to happen. So here's a myth that some people believe. Urinary incontinence is normal in older dogs. This is so wrong. Incontinence is never normal in any dog. It would always represent a concern worth discussing with your veterinarian. Now, sometimes the same underlying medical issue can manifest as either incontinence, remember that definition, or accidents. So let's sum it up by saying that any apparent loss of housebreaking in a senior dog, actually a dog of any age, should be addressed with your veterinarian. So here's a laundry list of things I'm thinking about when I hear that my patient is incontinent, when this is the presenting complaint from my client. There's diabetes, Cushing's disease, or kidney disease. And there, the mechanism of action is that these diseases cause a tremendous thirst. The dog is drinking excessively, and thus there's increased urination. It's simply an input-output balance sheet equation. But the list goes on. There's thyroid disease and other types of metabolic disease, a urinary tract infection, which the good news is that's treatable, the inability to get up and go outside because of arthritis or other mobility limiting conditions, and this is often really associated with accidents, but can be associated with incontinence too. Neurologic conditions, the bladder and the sphincter, that's the outflow gate that opens and shuts during urination, are under control of nerves. So if there's a nerve dysfunction, that can affect incontinence or lead to it. Estrogen deficiency, hormones play a role here, and even bladder cancer or urethral cancer, the urethra being that tube that leads from the bladder to the outside world. Again, I can't stress enough that it's critical that you seek out veterinary care for your previously housebroken dog who's now urinating in the house. I will occasionally have a client try to take matters into their own hands, and it seems like a common sense idea, by limiting their dog's water intake when they notice this to be a problem. And this is 1000% the wrong thing to do, except under very rare circumstances when it's done under veterinary supervision. In my 20-year veterinary career, I can count on less than one hand the number of times I've done what we call a water deprivation test, looking for very specific things. In general, at home, limiting water or forbidding water intake can really make these dogs very sick, even to the point of precipitating a life-threatening crisis. So I tell my clients that we're constantly looking for changes. If an owner notices a change in anything, water consumption, appetite, mobility, certainly incontinence, it warrants a veterinary visit. I'll never forget my sister calling me. I was standing in the toothbrush aisle at Walmart, and she called me and said, "Hey, I've got a problem. We're babysitting a dog for our friends, and the dog's not eating." And this was a huge problem, namely because they babysat this dog frequently, and the dog was a lab, need I say more, who wasn't eating. So this dog would always eat at their house. It wasn't the kind of situation where she was either a picky eater or she was nervous and didn't eat, in which case I would have been much less concerned. This was a marked change from normal. So I said, okay, we're on the phone, she's in a different state. And I said, do me a favor, lift up the dog's gums, let me know what that looks like. And I said, you've got to get to the vet today. I mean, this is concerning, this lack of appetite. This is a huge red flag. I don't want you to just wait and see what happens over the next day or two. Go to the veterinarian. And it turned out to be a very serious condition, which we will discuss on a future podcast. But for now, the point I want to make is that the red flag there was the change in what was normal for that dog. It seems like a common sense thing, but I do see clients sometimes miss it and wait too long. All right, back to our story of the free-flowing urine. Sometimes even simple things can cause incontinence and be easily addressed. So this is good news. I think sometimes clients wait to go to the vet because they're worried that it's going to be like something really big and major. But I can think of countless times where something was treatable, and once the diagnosis was made, the client was like, oh, I should have just come in sooner. So again, part of the message here is don't wait. So we already talked about urinary tract infections, that they can cause incontinence or accidents, and certainly very treatable. Another thing that's kind of surprising is that certain medications have been associated with incontinence, some seizure medications and even some pain medications in dogs. This is not a common scenario by any means, but if your dog develops incontinence, be sure to ask your veterinarian when you go in for your visit if there could be a correlation with any medications that he or she is taking, especially if the incontinence just started and correlated with just starting a medication too. The only medication I want to actually mention by name as an obvious bad actor when it comes to housebroken dogs having accidents in their homes is prednisone. I had a client come in this week for a second opinion for her dog who has a neurologic condition, and the neurologist, a specialist, had prescribed prednisone. It's commonly done. It's very reasonable, but the dog was now having accidents in the house. Prednisone causes increased thirst, and then urination is a prominent side effect, making dogs, like I said, just have this kind of overflow of just abundant urine in their bladder, and then accidents occur. So when you go to the vet, what's going to happen? What can you expect? Well, your dog's doctor is going to perform a physical exam and just check the dog from nose to tip, and that's nose to tail, and that's really important. There's a lot of things we can find just with our hands. And they'll also do some baseline lab work. And this is necessary to assess systemic health, what's going on inside, the internal organs, etc., and of course the urinary system. Now, here's a few tips about preparing for lab work. Number one, I always recommend bringing in a first morning urine sample. If you're asked to bring a urine sample, bring the first morning urine, or if you're going for an appointment related to the urinary tract, collect that first morning sample when your dog first gets up and you go out for the first time. Now, the reason for this is because this is going to demonstrate your dog's best kidney concentrating ability, because the dog probably hasn't been drinking a lot overnight. And so we're going to actually see what the kidneys can concentrate to, kind of in a best case scenario when there's not a dilution by a lot of water consumption. So you can collect that, you can put it in Tupperware or a glass jar, and you can put it in the refrigerator if there's going to be hours and hours before your appointment. At the time of your appointment, your veterinarian may wish to get a fresher sample. So the advantage of that sample that you got, the first morning sample, is it's really going to be helpful in us understanding your dog's what we call urine-specific gravity, the concentrating ability. And so sometimes if I'm dubious about a dog's ability to concentrate their urine, I'll actually ask an owner to collect that first morning sample over the course of several days and just store them in the refrigerator, date them, and then bring them to me because I can check the urine specific gravity, and that's not something that's really going to change significantly over time. What does change over time in as short as 30 minutes are crystals in the urine. So really the best urine sample for a complete evaluation of what's happening at the cellular level is a sample that's taken fresh within 30 minutes and evaluated right away. So that's one that your vet may ask for you to collect, maybe with the technician's help, right in the parking lot of the veterinary hospital. So you can see that different samples actually have different diagnostic value. Now, if your veterinarian wants to have a urine culture, and that's the gold standard test to see if there's any bacteria in the urine, really to look for a urinary tract infection, then essentially we're going to have to take a sterile sample. I know it's done in people. I don't know how it is for men, but for women, they send us into the bathroom and they give us these little towelettes and the jar, and they say, you know, try to get a midstream sample, and it's a big circus. But for dogs, we don't do that. I mean, it's just, you're outside, you've got hair, you've got dog, you've got wind, you've got the leaves blowing. Collecting a sample outside and sending that off to be tested for bacteria, frankly, I think is a real waste of money. I think the likelihood of having false positives is so high, I just do not do it ever. So we need to take a sterile sample right from the bladder, and the best way to do that is just with a little needle into the bladder. It's called a cystocentesis. That translates into like bladder poke. And it sounds barbaric, but it is done thousands of times. I mean, I don't know, probably tens of thousands of times every day in veterinary medicine around the country. And the likelihood of a problem is minuscule. So I always say that dogs are not mufflers. We can't make a guarantee. So I can't guarantee you that there could never be a complication, but I'm 1,000% sure that the benefits outweigh the risks of getting that sterile sample when you're testing for bacteria and growing it out for a culture. So that's a discussion to have with your veterinarian. But if they tell you we need to take a sterile sample, sometimes in male dogs, it's done by passing a catheter. But more often than not, it's done with this little needle, and really, you gotta trust me, it's not a big deal. And often it's also done with an ultrasound guiding where the needle can go, so it's very precise. Okay, let's see what happens next. Your veterinarian may also run blood work, a CBC to check red blood cell count, white blood cell count, a biochemistry panel to look at kidneys and kidney values and liver values and blood sugar and electrolytes. And they may even test blood pressure because that can be relevant and can be a clue in several of these diseases and is an issue often with kidney disease. Now, another tip, I would not recommend feeding your dog breakfast the morning of your appointment. Water is fine, you don't need to withhold that. But food sometimes causes increased lipids in the bloodstream as they're being digested, and this can skew the results of the lab work that we need. So anytime you know your dog's going in for blood work, and I'm not talking about just a routine heartworm test, which is 2 drops of blood and something that's done often at annual visits. I'm talking about a diagnostic blood panel. I always recommend that be done on a fasted dog. So let's get to the bottom line. How is the incontinent dog going to be treated? And here I get to go off on a soapbox of mine. I don't know. Diagnosis is key to developing the treatment plan and providing what we call a prognosis, meaning the expected outcome. I really can't stress this enough, and I have an upcoming podcast on this topic as well. It's called Making the Diagnosis. I know often for an owner who's concerned about their dog's health and they're cleaning up urine all the time and the dog's actually embarrassed by having accidents in the house, they just want it to stop. But trust me, getting the diagnosis is that key foundational piece so we have the best and most appropriate treatment course and really understand the trajectory that we're on. So again, the goal should be to nail the diagnosis and treat accordingly. My daughter was in speech and debate last year, and the kids are taught to make their points and then state the impact. What's the impact of this? In other words, what's the bottom line? So here's the impact of this podcast as I see it. Number 1, be observant. If you notice a change in your dog's behavior or habits, report it to your veterinarian. Have the discussion and go from there in terms of how your veterinarian wants to handle it. Number 2, incontinence is never normal. Number 3, expect a workup when you go to the veterinarian for the problem, and also know that sample quality can affect results. And number 4, as I said just a few moments ago, diagnosis is the key. Thank you for listening to today's episode of the Buzby Dog Podcast. I would love to have you join us on social media if you want to continue the discussion. We are on Facebook at ToeGrips, Instagram at Dr. Buzby's ToeGrips, and Twitter at Dr. Buzby. We'll see you there.